Good afternoon. I'm Elizabeth Marchetta. I'm the Executive Director of Food and Nutrition Services at Baltimore City Public Schools.
And hi, I'm Erin Hager. I am an associate professor at the University of Maryland School of Medicine, and I chair the State School Health Council. And so we're here today to talk about nutrition, environment, and services and how this is linked to mental health. So as many people know, healthy eating and the ability to secure food and live in a food secure household is linked to positive mental health. And so today we'll be discussing how and why we can prioritize the nutrition environment and those services in order to support student mental health. So again, a healthy diet and food security can contribute to positive mental health, and some ways that schools can prioritize this area is to find innovative ways to deliver meals to students and families who cannot access meal distribution locations. They can provide mental health resource handouts with each meal given at school, or if there is a community distribution site where foods are provided to families, those types of resource handouts can be given then. Or they could equip nutrition services staff with the basic skills to identify youth distress and with the knowledge of how to inform counseling staff when a youth is in distress.
In Baltimore, we supported efforts to get home delivered meals to many of our homebound students during the early COVID pandemic. We also used our existing meal distribution locations as places and hubs to serve other things, from diapers to other sorts of resources or handouts related to the various things that families have depended on school to support pre-pandemic. And then we recognize that our food and nutrition staff, even before the pandemic, might see students up to 4 times a day, and that's every student. So the value of that relationship is extremely important. And we have trained our staff in de-escalation and social emotional learning because we know it is really stressful, no matter what is going on in your life, right when you're hungry and you haven't eaten in a while.
That's great. I love the work that you guys are doing in Baltimore City.
Thanks.
And so now we're going to talk about how we can address the nutrition environment and services in order to promote positive mental health in a response to the pandemic, so during the next school year. So some ways we can do this would be to find innovative ways to deliver meals to students and families who cannot access meal distribution locations. We can provide mental health resource handouts, again, with each meal given at school or at the meal centers. And this, to some extent, will still be going on next year, even though most kids will return to school in person. But there will be times when schools are closed again, as they are every year. And once again, we can equip nutrition services staff with those basic skills that we just discussed in the prior slide.
The transition back from the pandemic will be an adjustment for everyone. And we need to remember to include our school food services staff in these return to normal activities as we support students and, the full child beyond, the meal. It is really important that as different child health professionals, we come together to support mental health. Thank you very much for joining us.